Well, thanks for being a part of this community conversation. I'm Kyle Reese, along with my colleagues Nancy Broner and JC Wilbach. And OneJax is committed during this time of COVID-19 to have meaningful conversations with leaders in our community. And so on behalf of the OneJax Institute at the University of North Florida, we're so glad that you could join us for this conversation today.
And it's my pleasure to welcome Dr. Jeffrey Levenson to our vodcast today. Dr. Levenson is a local ophthalmologist, but very active in the community. He's the co-developer and coordinator of Jacksonville's Gift of Sight, president of Vision is Priceless, and chief medical officer of C International. And we'll ask him to explain all that here in a few minutes.
But before we get to all of the local things and even international things that you do, Dr. Levenson, tell us a little bit about how you chose medicine in general and ophthalmology in particular.
You know, I'd love to have a wonderful formative story, but I kind of fell into it by accident. What happened was I was in college, fell in love with a Florida girl. I was up at Princeton at the time. Fell in love with a Florida girl who was in medical school. And I thought, okay, I could do that too. And so I came down to Florida, went to University of Florida Medical School, in part because I was just looking for something to do, and in part because I wanted to hang out with this woman who's now my wife of 40 years. And then with regard to ophthalmology, most of the decisions, most of the really important decisions we make in life, we make largely out of ignorance. It's not possible to know 10 and 20 and 30 years who we will be and where our passions will lie and what we will do, what we will love. And yet ophthalmology is uniquely suited to my tastes and my passions. So I think I accidentally chose perfectly. A part of living a healthy, happy life is making the decisions we make into the right decisions, becoming the person who fate has destined us to be. So I'm not sure that I wouldn't have been just as happy doing 100 other things, but I feel now like I was born to do what I'm doing now. Like it's what I'm here for.
Wow, what a
all by accident.
And if it was. So it is going to be our honor to celebrate your work when we recognize you as a 2020 OneJax humanitarian. Much of your humanitarian work is international. I mean, you do so much locally, but let's talk about what you do internationally, because of course it would be impacted this year by the pandemic. But tell us what C International is and what you do with that.
Sure. Let me start with a very basic fact, and that is that there's a lens inside our eye, and that lens is supposed to be clear. And when we're born, that lens is clear and we see beautifully through it. And over the course of a lifetime, the lens inside the eye naturally tends to get cloudy. And it happens earlier in the setting of poor nutrition or people who are working out of doors or in the setting of poverty. But in most people, as we get older, the lens inside the eye gets cloudy, and as it does so, we lose vision. We call that a cataract, and cataracts are the leading cause of blindness all around the world. Here in the United States, cataract surgery is done over 3 million times a year, and it takes about 15 minutes, and very few people in the United States are blind from cataracts because we fix them. But there are roughly 200 million people around the world who are losing vision, who have moderate or severe vision loss from cataracts, for whom cataract surgery is utterly beyond their means. There are roughly 20 million people in the world who are completely blind in both eyes, their productive lives completely ended, dependent and desperate for want of a 15-minute surgery. It's worth noting that that surgery can be done for about $25. There have been modifications to cataract surgery that enable it to be done in such a manner that it doesn't require technology or expensive equipment. And we can now do a cataract surgery for $25 in about 10 or 15 minutes. And C International's goal is to bring cataract surgery to the 20 million people who are blind in both eyes and the other 200 million people who are rapidly losing vision, and to make it affordable and accessible. And in doing so, we hope to end needless blindness in the world. It's worth adding that more than half of all the blindness in the world is from cataracts, and 90% of all the blindness in the world occurs among people who live on less than $5 a day.
Wow.
And it's entirely within our means to address that problem, to make a meaningful impact upon that problem. So I'm the Chief Medical Officer of SEE International. We do over 200 trips a year to over 50 different countries, teaching cataract surgery techniques, providing needed materials and equipment to doctors overseas who are in need of them, and providing whatever that link may be that connects patients in need to doctors who can provide surgery for them. And it's a wonderfully fulfilling and rewarding position to hold.
It's really interesting. When you research SEE International and your biography, you have modified the procedure for a different setting or circumstance. I'm scientifically clueless. So for someone like me, what is the difference between if I go in for cataract surgery here in Jacksonville versus someone who is being served by SEE International?
So here in the United States, we operate on cataracts when they're early. And the techniques that evolved here are meant for early cataracts. Early cataracts are sort of mushy. They're the consistency of melted ice cream. And we've devised here in the United States a little handpiece, looks like a little pen, but the tip of it vibrates 40,000 times a second. And it's a miniaturized jackhammer. And we make a tiny incision, and we go in with this miniaturized jackhammer, and we liquefy and pulverize and suck out the cataract, and then replace it with a plastic lens. Well, in the poorer parts of the world, cataracts don't get operated on when they're early and soft and mushy. People wait until they're blind. And so cataracts there are rock hard. And as you might imagine, it's not so easy or safe to liquefy or pulverize a rock hard cataract. And so Western techniques don't work well in the third world. And what third world doctors did is they sort of re-engineered cataract surgery. They modified the incision so we don't make it with $1 million laser. We make it with a 15-cent general surgery blade. It's a little bit wider. They took a little hypodermic needle that you can buy for 25 cents, bent it in the shape of a fish hook, and you can slide that needle underneath a rock-hard cataract and slide it out through that modified incision. And this technology-dependent $2,000 surgery in the United States can be done with minimal technology and minimal cost overseas. And the technique that they have works best for the cataracts that they do, just as the technique that's been developed here works best for the cataracts that we do. It was uniquely interesting the way the technique was evolved. It evolved without corporate or government support, just doctors collaborating online, doctors who'd gotten tired of telling their blind patients who were poor that there was nothing they could do. And it's changed the world for millions of people.
Wow. Amazing. And then how are you going to manage? I know you had trips planned, and and of course every week brings some different level of the pandemic.
Yeah.
What are you going to do this year?
So our 200 trips, what we used to do is we would send American doctors overseas, and they would work alongside developing world doctors who were learning this technique. And also we would bring over equipment and bring over materials. We're not able to go and travel to those places any longer. So we have pivoted, and we are working with doctors who are well established in the technique and providing them the materials and the equipment and the consumables to do more surgery. And we'll continue to do that through the period of COVID restrictions. So we will probably do another 100,000, or we will enable another 100,000 cataract surgeries this year, but we'll do so not side by side working with our host doctors in poorer countries. We'll send them the supplies and the materials and work with doctors who are well established in the technique. We're also teaching the technique now online in the way that that many people are trying to learn, and the way that much of education has shifted online. There are certain things you have to be there and work alongside somebody to teach, but we are hoping to fill that gap as best we can. C has also pivoted more towards a domestic role. There are probably 30 million people in the United States today who are unemployed, who were not unemployed 6 weeks ago. And along with unemployment comes loss of health insurance in most states. And so we are encouraging our army of American doctors who used to go overseas to do these surgeries to do them here in the United States. And we're pivoting to support doctors here in the United States who are happy to provide those services. And here in Jacksonville, that's become my new goal. There are probably 1 million Floridians who are today unemployed, who are not unemployed 6 weeks ago, and we'll have to find the means to provide the care they need.
Yeah.
Until we as a country get back on our feet.
And how are we doing here in Jacksonville? What is your work at Vision is Priceless and Gift of Sight?
So Vision is Priceless is a charity that started by screening preschool children for lazy eye. Children learn to see over the first 5 years of their life. And if the two eyes are working together, both eyes develop normal vision. But if one eye's turned in a little bit or turned out a little bit or not properly focused, if a child needs glasses and doesn't have access to glasses, the connections between the eye and the brain that are supposed to form in the first 5 years of life form incompletely. And children can develop what's called a lazy eye, an eye that never developed those connections. If we don't find that by the age of 5 or 6, beyond that age, it's not reparable. So Vision is Priceless goes to every school, every preschool in the 5-county area, does 40,000 preschool screenings every year, and identifies children who are in need of our services. As an offshoot, we developed the Gift of Sight program. The idea is that nobody in the United States should be blind for lack of access to healthcare. And so the promise I made to myself maybe 25 years ago is that I would try to find a way as best I could to do cataract surgery and provide other needed care to people in Jacksonville who fall between the cracks, people who are not poor enough for Medicaid, not old enough for Medicare, who don't qualify for vocational rehab or Division of Blind Services. And every year for 25 years, we've found, used to be maybe 20 or 25 people a year, and now it's more like 100 people a year who are slowly or rapidly going blind from cataracts and who otherwise fall between the cracks, and we find ways to get their surgeries done and get them back to work and get them back to living meaningful, productive lives.
Amazing.
We call that program the Gift of Sight. I've sort of relegated all of the coordination of it to Vision is Priceless, and there's now an army of Jacksonville doctors, over 80 doctors who volunteer for Gift of Sight services. And together we do thousands of exams a year and provide hundreds of surgeries a year.
It's wonderful.
That's great. Well, we could talk longer about all of the volunteer work you do, but we want to talk a little bit about your day job. And so tell us how the practice of medicine and ophthalmology has changed in the age of COVID-19.
So we were closed for 6 weeks to all but emergencies. And only last week have we started to open up again. It's going to be tricky. It's going to be challenging. We are spacing people appropriately and practicing social distancing. We're wearing masks in the office, and we're asking our patients to wear masks as well. We are cleaning down every room after every use. And what that means is that we will probably be limited to half, maybe 2/3 of the capacity that we used to have. So we'll have to expand our hours, maybe work some Saturdays to try to serve the needs of our community. It's going to be challenging, and it looks like it's going to be, it looks like it's not going to go away anytime soon. At least that's the impression I have now. We're waiting on a treatment or a vaccine that may well be years in coming. So we're rolling with the punches and adapting as best we can. We can safely see people, just not as quickly and efficiently as we used to be able to.
Well, I tell you, you've helped so many people locally and throughout our country and certainly internationally. And I know I've seen some of the results, the pictures of people in these third world countries that you've been to who are just stunned to be able to see again after what would be a fairly bleak life and inability to work and contribute. So
it's true here in the United States. I canceled about 150 surgeries over the last 6 weeks because of COVID. And tomorrow my surgery center opens for the first time. And they told me they only wanted to do 10 patients tomorrow because they wanted to be sure that we had all the mechanisms down. So I looked through my 150 charts and I found the 10 most blind people. And among the people I'm doing tomorrow are 7 people who are completely or nearly completely blind in both eyes. Wow. So I'm very much looking forward to tomorrow, because typically we do the surgery and people who are blind, right then and there, you take the drape off of their face and they say, "Oh my gosh, I can see the ceiling. Oh my gosh, I didn't know what you looked like." So I'm looking forward to a day of celebration tomorrow. Most of the people we do in the United States, you know, they don't wait till they're blind. They're a little bit blurry. And my wife says that I spend most of my days bringing sight to the slightly blurry. But among the more extreme patients, so we literally bring sight to the blind. It's an almost biblical feeling when you restore sight to somebody who's been severely disabled. So I'm very much looking forward to getting back to it. It's been a lonely and soul-searching 6 weeks. I found that I love, it's nice to not work as hard, but I'm looking forward to getting back to doing what I'm supposed to be doing.
Oh my God.
Speaking of your spouse, who is in your conversations together, have you looked into your crystal ball, and how do you think the practice of medicine is going to change post-COVID-19? You talked about the short-term changes. What do you feel like long-term that's going to look like?
And I should add, I'm going to include in this discussion the opinions of my daughter, who is an intensive care doctor in a COVID unit in Chicago. So there are a whole bunch of, it's fun to sit around and imagine what the post-COVID world will look like. And there are all these theories about how we will change, how human interactions and work and education will change. And I think that what my own impression is that what we will find is that there are many jobs that can be comfortably done at home, and that lawyers probably will not have, a lot of businesses will probably not have big fancy offices. I think if you're invested in commercial real estate, it's a good time to sell because a lot of us will be working from home. But I don't think that's true of medicine. I think patients can't wait and doctors can't wait to get back to being face-to-face, to having the special, intimate, close connectivity that a doctor and a patient share in a doctor's office. I also suspect that education, that both teachers and students can't wait to get off their computer and back to classrooms. I think that we will learn that the internet is a wonderful thing, but that it doesn't take the place of close personal interactions. I think a lot of people miss the camaraderie of being in the office. Even if you can do the work at home, there's something about hanging around with your the people you work with who become your friends, and a community of like-minded people. I think that probably medicine can't wait to get back to the way it used to be, if that ever happens. And then the question is, will we as humans have the ingenuity and the creativity and the entrepreneurship to solve this problem as we've solved so many other problems? And if I can take a moment to elaborate upon that. 50 years ago, the average life expectancy of a human being born on the planet Earth was about 40. And roughly half of all children, 40% of all children, died before the age of 5. And every day that has gone by for the past 50 years, average life expectancy has grown by 9 minutes. We live 9 minutes longer today than we did yesterday.
Wow.
And the average life expectancy in the world is now 72. People in the poorest parts of the world live as long as Americans lived in 1950.
Wow.
So we have made incredible strides. And I, for one, am optimistic that this too shall pass, that we will have an answer, whether it's a vaccine, whether it's a pharmaceutical agent. I think that just as yellow fever and malaria kept people from living in the state of Florida until 50 years ago, that South Florida was basically vacant of occupation until air conditioners and the swamps were drained. I think that someday COVID will be in our rearview mirror, and we'll have ways to respond to it that enable us to get back to normal life. Probably take a year or two.
Yeah.
But I have no doubt that we as human beings have the patience and the ingenuity and the creativity and the moxie and the will to see this problem through.
Well, Jeff, it's very obvious from your the way you describe your work and the heart you have for people, why you are a true humanitarian. So we thank you so much for sharing yourself with the world, really. A very humble guy, just wanting to cure blindness, little small goal, blindness, and you're doing it. So we are so appreciative that we can call you friend and fellow community member. So thank you so much for your work and for being with us.
It's been my pleasure. I'm so grateful to be a part of the OneJax community, and I'm eager to share the love with OneJax and to be a part of everything you guys do.
Thank you. Thanks very much, Jeff, and thanks for
Thank you.
being with us today.
It's my pleasure.
Thank you.
Take care.
Thanks.